Gentlemen, let's be honest for a moment. If you care about your health, your confidence, and your future as a man, this is the video you cannot afford to skip. Because there are 10 things you might be doing every single day, small habits, often invisible, that slowly destroy erections, reduce sensitivity, and even put your long-term sexual health at risk. I'm not here to scare you, I'm here to empower you. Because once you know what to avoid, you can protect your performance, confidence, and dignity for life. Before we dive in, do me a favor. Hit that like button so more men can see this. Subscribe if you haven't already, and comment below, where are you watching from today? I love seeing men from all over the world taking charge of their health and building this community. Here's a truth most men don't realize. Your penis is like a warning light on the dashboard of your body. When things go wrong, blood flow, hormones, even your heart erections are often the first signal you'll notice. A weak or fading erection isn't just bad luck or a sign that age is catching up. It's your body saying something deeper is happening. Ignore it, and you could miss the chance to prevent bigger problems, like heart disease or vascular issues. Pay attention, and you can turn things around. For those new here, I'm Dr. Jocelyn, a board-certified urologist with 5 years of experience, specializing in men's health and sexual medicine. I've treated hundreds of men facing erectile dysfunction, low testosterone, and prostate concerns, and I can tell you with confidence, small, smart changes make a massive difference. Today, we're going step by step through the 10 things you should never do to your penis, and more importantly, what to do instead to stay firm, healthy, and confident. Stick with me until the end, because I'll also share a safe, natural way to support stronger erections without relying solely on prescription medication. Number 1, don't ignore changes in your penis. Think of your penis as a canary in the coal mine. If erections weaken, it often means blood vessels are narrowing. Why does this matter? The penile arteries are tiny, so circulation problems show up here years before they appear in your heart or brain. That's why men with erectile dysfunction are at higher risk for heart attacks within 5 to 7 years. Biologically, weak erections equals reduced blood flow equals a heads up about systemic health. Emotionally, ignoring this signal risks more than your sex life. It risks your life. Practically, if you notice changes, don't brush them off. Get checked. Number 2, don't try dangerous home remedies. I've seen it all. Men rubbing apple cider vinegar on their penis, building devices out of rubber bands and bottle caps, or trying extreme stretching. Biologically, these can cause micro tears, nerve damage, scarring, and sometimes permanent erectile dysfunction. Emotionally, fear and frustration can take over if you damage yourself. Practically, only use medically approved devices, like proper constriction rings, and never improvise. I've treated men in the ER with metal rings stuck on their penis. Some required power tools for removal. Please, don't take the risk. Number 3, don't neglect hygiene. It sounds basic, but poor hygiene is one of the most common problems I see. Uncircumcised men gently retract the foreskin, clean with mild soap, rinse, and pat dry. Biologically, smegma buildup can lead to infection, inflammation, and even penile cancer. Emotionally, neglecting hygiene can reduce confidence in intimacy. Practically, consistent, gentle care keeps your penis healthy. Avoid harsh soaps, they strip protective oils. Number 4, don't ignore pain, bleeding, or lumps. Pain during sex, blood in urine, lumps, or ulcers are never normal. Biologically, could indicate infection, kidney stones, or in rare cases, cancer. Emotionally, ignoring it creates anxiety and fear in the bedroom. Practically, see a doctor immediately. If your doctor judges you, find one who doesn't. You deserve care without shame. Number 5, don't take risks during sex. Penile fractures are real. A sharp bend during an erection can tear tissue. You'll hear a pop, feel immediate pain, swelling, and bruising. Lubrication matters. Lack of it increases friction, risk of injury, and can make you feel out of control. Biologically, protects tissue integrity and blood flow. Emotionally, reduces stress and increases confidence. Practically, use lube consistently and be mindful during sex. Number 6, don't overheat your testicles. Testicles need to be cooler than your core to produce sperm and testosterone. Hot tubs, laptops on your lap, or phones in pockets raise temperature, harming sperm and lowering testosterone. Practical tip, Shift your laptop to a desk and keep devices away from your lap. Number 7, don't grip too hard when masturbating. Death grip syndrome is real. Too much pressure desensitizes nerves, making partner sex less satisfying. Practical tip: lighten your grip, add lubrication, and retrain your body for gentler stimulation. Number 8, don't smoke. Nicotine damages blood vessels, reducing nitric oxide, the signal that triggers erections. Biologically, chokes off circulation. Emotionally, reduces confidence and sexual satisfaction. Practically, quitting improves erections and protects your future health. Number 9, don't beat yourself up. Performance anxiety is a silent killer. Stress activates fight or flight hormones, constricting blood vessels. Emotionally, self-blame spirals confidence downward. Practically, remember, your worth isn't defined by a single performance. Talk to your partner or a doctor, but don't carry it alone. Number 10, don't stop using it. Use it or lose it is real. Erections deliver oxygen-rich blood, keeping penile tissue elastic and sensitive, biologically. Without regular blood flow, scar tissue forms, sensitivity fades, and size can decrease slightly. Practically, even solo stimulation helps maintain tissue health. Nighttime erections are your body's natural maintenance system. So, what should you do to protect and improve erections? Circulation. Exercise regularly, eat nitric oxide, boosting foods spinach, beets, dark chocolate, and maintain healthy weight. Hormones. Manage stress, prioritize sleep, and address low testosterone if necessary. Safety. Keep sex-safe lubrication, approved devices, gentle technique. Hygiene. Maintain simple, consistent care. Stimulation. Keep your penis active. Intimacy or solo stimulation ensures tissue health. Natural support. Supplements like electrolyte from watermelon extract can help, converting into nitric oxide to relax penile arteries and improve blood flow. Listen carefully. Erectile issues are not the end of masculinity. They are signals, not shameful failures. Men in their 50s, 60s, and even 70s have restored their sexual health, energy, confidence, and relationships by applying small, consistent steps. So take this as your wake-up call. Respect your body, respect your penis, avoid these 10 mistakes, and you'll protect performance, health, dignity, and future vitality. If this video helped you, share it with another man who might benefit. Hit like, subscribe, and comment what's one change you're committing to today. I'm Dr. Jocelyn, reminding you, age is not the end of vitality. With the right care, you can enjoy freedom, confidence, and intimacy for decades. Take care of yourself. You are absolutely worth it.